Welcome, everyone. My name is Kayla Lalumiere. I am a proud NutraPhoria alumni, a holistic nutrition practitioner, health coach, and nutrition counselor. I have been in the medical field for 20 plus years. I am also the gold winner of the community votes from 2025 to 2026 in Cambridge, Ontario, as well as I have just won the Canadian Choice Awards for Holistic Nutrition Services. Today, we will explore the importance of combining GLP-1 medications with lifestyle changes such as healthy eating, regular exercise, stress management, and good sleep hygiene to maximize benefits and minimize side effects. I will be sharing my screen with you right now so you can see my slides. I'm hoping you can see it. Perfect. It looks like you can see it now. So this is my bio screen. So my company is Triple Goddess Nutrition and Holistic Health. It is inspired by the symbolism of the Triple Goddess. My practice represents growth, transformation, and empowerment through every stage of life. This is my Metabolic Reset webinar. This is just a little snippet of my 6-month Metabolic Reset program that will be launched within the next month or two, so keep an eye out for that one. I am going to be launching that globally. So in my Metabolic Reset program, this, like I said, is just a snippet of Metabolic Reset when using GLP-1s. So there are quite a few different benefits and reasons why we would do this. So the first one is for restoring baseline metabolic function. GLP-1 receptor agonists improve insulin sensitivity and glycemic control by regulating glucose levels and enhancing pancreatic function. Number two is for supporting appetite and weight regulation. GLP-1 medications slow gastric emptying and reduce appetite. Number three is preventing plateaus in weight loss. So over time, of course, in any weight loss journey, you will plateau as your body adjusts to lower caloric intake. Improving energy. GLP-1 medications can decrease resting metabolic rate during weight loss. Reset will also involve resistance training and activity modulations. Number five, we want to minimize side effects. GLP-1 agonists can cause gastrointestinal side effects like nausea, bloating, and diarrhea. So we want to see if we can minimize that as much as possible. We want to enhance hormonal balance. So GLP-1 medications influence hunger hormones like ghrelin and leptin, supporting gut health. The gut microbiome plays a crucial role in metabolic and weight management. Facilitating long-term behavioral change and reduction of risk of relapse. So components of a metabolic reset, we want to do nutritional focus, activity, mindful eating practices, stress management, sleep hygiene. Now, there are different types of GLP-1 receptor agonists. Some of these will be very familiar to you, some of them won't. I would familiarize yourself with the names of this medication, just because a lot of people are now on it. So some of the main ones are Ozempic, Wegovy, Rybelsus. There are some people that are still on Victoza and Saxenda. Here are a couple of the other ones. Trulicity, some people are still on that. I haven't come across that too often. But Mounjaro and Zepbound seems to be quite popular, as well as Ozempic at this point. Now, what are the benefits of GLP-1 receptor agonist? So number one is blood sugar control. We want to enhance insulin secretion. Okay, so GLP-1 agonists stimulate the insulin release in a glucose-dependent manner, reducing the risk of hypoglycemia. weight loss. The GLP-1 agonists reduce hunger by acting on the brain's appetite centers, specifically the hypothalamus. Okay, it also it slows the stomach gastric emptying. So there is a delay in the stomach emptying, which enhances feeling of fullness and decreased calorie intake. Okay, it also promotes loss of visceral fat, which is associated with metabolic diseases. Number 3 is cardiovascular benefits. So with some GLP-1 agonists, like Saxenda, Victoza, Ozempic, Wegovy, Rybelsus, they are proven to lower risk of major cardiovascular events, like heart attacks and strokes with people with type 2 diabetes. It does improve lipid profiles. It can lower the LDL cholesterol and triglycerides. And it is associated with some reduction in systolic blood pressure. It also can help against diabetic kidney disease, as well as preventing declines in brain aging diabetes. It also helps with the other benefits are weight independent benefits, so anti-inflammatory effects. So it may reduce chronic inflammation associated with metabolic syndrome and obesity. It does improve beta cell function, so that it enhances the health and function of the pancreatic beta cells, potentially slowing diabetes progression. So there are different ones. So there is long-acting formulas like Ozempic, Wegovy, Rybelsus, Trulicity, and Zepbound, which are once weekly injections. And that actually helps to improve patients actually, doing it and making sure that they're adhering to that medication. There is an oral form, which is Rybelsus, which is a pill form, which some people prefer if they don't like to inject or they're afraid of needles. So positive effects beyond diabetes. GLP-1 agonists like Wegovy are approved for treating obesity, even in individuals without diabetes. There is potential use for it in patients that have PCOS. There is some evidence that shows these drugs may improve weight and insulin resistance in women with polycystic ovarian syndrome. It is also early studies indicate that it may help with NASH, which is a condition linked to fatty liver disease. It used to be called NASH, but recently in the literature, it has been converted to MASH, which is metabolic associated. Okay. Sleep apnea, there is emerging evidence showing that GLP-1 receptor agonists can reduce the severity of obstructive sleep apnea through weight loss and improvements to upper airway function. There is low risk of hypoglycemia. So unlike insulin, GLP-1s work in a glucose-dependent manner, which significantly reduces the risk of dangerously low blood sugar levels. There is an improved quality of life. So patients often report better energy levels, improved confidence due to weight loss, and relief from diabetes-related stress. There is some emerging research that is coming down the pipeline in regards to neuroprotection in Alzheimer's disease and cancer protection. Side effects. So GLP-1 receptor agonists, while highly effective in managing type 2 diabetes and obesity, can cause various side effects. These can range anywhere from mild and temporary to more serious and rare adverse effects. So the typical mild effects that happen are nausea, vomiting, diarrhea, constipation, bloating, and flatulence. There is some appetite suppression, and sometimes people get some taste changes. So their taste something that tastes normal to them before now has like a funky taste to it. So they may discuss that with you. Some people do get fatigue and dizziness. Normally, this happens in the beginning parts of patients starting the medications. Moderate side effects that you do need to watch out for are redness, swelling, pain at injection sites, dehydration, hypoglycemia. It is rare when used alone, and it is more likely when combined with other diabetes medications like insulins. So you definitely want to make sure that you do have a physician that is also involved with your client or your patient. Headaches, they can be typically mild, but they can happen. Serious side effects are pancreatitis. That symptoms for that is severe abdominal pain, nausea, and vomiting. Gallbladder issues, thyroid tumors. People panic about this, but it's only a real concern in patients that have a history of multiple endocrine neoplasia or a history of MTC in the family. Kidney problems, acute kidney injury can occur, particularly if there's severe dehydration, which results in vomiting and diarrhea. Allergic reactions, rare but possible. So also keep an eye out for that. Long-term risks and considerations. So potential cardiovascular risks. Although GLP-1 receptor agonists generally reduce cardiovascular events, rare causes of heart rhythmia disturbances have been reported. So be aware of that. Now, also there is issues with the eye. So rapid improvement in blood sugar control may exacerbate the existing diabetic retinopathy. So regular eye exams are recommended, but it is a very rare associated eye complication called NAION, and it is at a slightly higher rate in GLP-1 users, but even at an increased rates, the risk is still very small. Potential mental effects. Some patients report mood changes or increased in anxiety. There's more research that is needed in this area. Precautions and contradictions. So you'll see under this slide, kind of the same thing that we already just started talking about. So our big thing with it is make sure that the patient is starting low, go slow. So gradual dose escalation can minimize GI symptoms. Hydration is super important. That'll help prevent dehydration from vomiting and diarrhea. Dietary adjustments, so smaller low-fat meals can help reduce nausea. Monitor blood sugar, especially for those patients that are using it for weight loss and diabetes. Myths. There are a lot of myths around the GLP-1s right now. So some people believe that GLP-1 medications are magic pills for weight loss. They are Wegovy, Ozempic, Zepbound, that those are effective for weight loss, but they are not a magic solution. Okay. So these medications can help regulate appetite and glucose metabolism, but sustaining weight loss requires lifestyle changes, including healthy eating, exercise, and behavioral modifications. Once the medication is stopped, weight regain is possible if lifestyle changes are not maintained. GLP-1 receptors can cause hypoglycemia, which is low blood sugar. So GLP-1 medications reduce blood sugar in a glucose-dependent manner, meaning that they only enhance insulin release when blood sugar levels are elevated. So this actually minimizes the risk of hypoglycemia compared to other diabetes medications like insulins. GLP-1 medications are unsafe for everyone. Reality of that, GLP-1 agonists have been extensively studied and considered safe for most individuals with type 2 diabetes or obesity. However, you still need to do a history and make sure that this is the right medication for your client. 4, these drugs are only for people with diabetes. So this is untrue. So while it was originally developed for type 2 diabetes, GLP-1 medications are approved for weight management as well. Okay. Myth, they work the same for everyone. Reality is individual responses to GLP-1 medications vary. While many people experience significant weight loss or glycemic improvements, others may have more of a modest response. Okay, each person's journey is different, so keep that in mind. 6, myth, GLP-1 receptor agonists damage the pancreas. Concerns about pancreatitis arose early in the GLP-1 research, while there are still small risks of pancreatitis, particularly in patients with a history of the condition. Large studies actually show that the post-market surveillance has shown no definite link between GLP-1 medications and long-term pancreatic damage in most users. Myth, they are only beneficial for short-term uses. So GLP-1 receptor agonists can be used for long-term to manage type 2 diabetes and chronic obesity. In fact, ongoing use is often recommended to maintain weight loss and improve blood sugar control and reduce cardiovascular events. Number 8, GLP-1 medications make it impossible to enjoy food. While GLP-1 medications reduce appetite and alter hunger cues, they do not eliminate the ability to enjoy food. Many users find that their cravings for unhealthy, high-caloric foods diminish, allowing them to focus on healthier eating habits without overeating. 9, myth, they weaken the heart. On the contrary, the GLP-1 receptor agonists have proven cardiovascular benefits. They reduce the risk of major adverse cardiovascular events like heart attack and stroke in individuals with type 2 diabetes and high cardiovascular risks. They also help lower blood pressure and improve lipid profiles. Myth. GLP-1 medications are addictive. GLP-1 receptor agonists do not have any addictive properties. They work by mimicking the body's natural hormones to regulate appetite and blood sugars. However, reliance on the medication without adopting healthy habits can create dependence on it, depending on the behavioral of the patient. 11, myth. Rapid weight loss with GLP-1 is unhealthy. While GLP-1 medications can result in significant weight loss, they do so gradually over weeks and months. It's not just a quick boom and you drop all the weight at once. It is a slow progression. Myth 12, GLP-1 medications stop working after a while. Reality is weight loss plateaus can occur. It happens in any type of diet, any type of weight loss. So the metabolic rates may need to adjust to the weight loss. So that's when you will add in more exercises, resistance training, dietary changes. So you would push towards that. Myth, the GLP-1 medications harm fertility. There is no evidence suggesting that GLP-1 receptors harm fertility. Okay. It can improve metabolic health and weight, which may positively impact fertility, particularly in conditions like PCOS. Sorry. Number 14, everyone experiences severe side effects. Not everyone experiences side effects. Some individuals will experience mild gastrointestinal symptoms like nausea and diarrhea, which often subside after the first few weeks of treatment. By debunking these myths, it's clear that GLP-1 receptor agonists are powerful tools in managing metabolic conditions when used appropriately under medical supervision with lifestyle changes. The other one that I want to jump to is people think that you will lose all your muscles. The reality is muscle loss is a normal part of weight loss, regardless of the method. Okay. So, significant differences between the GLP-1s. So there are different differences between the various GLP-1 receptor agonists in terms of their structure, duration of action, administrative routes, indications. So when we jump into this screen, it's going to show us the duration of action. So there are short-term GLP-1 agonists. So these ones are normally required for you to take twice a day or daily. It does control by slowing down by slowing the gastric emptying and suppressing the glucagon secretion. There's also the long-term acting one. This one is required once daily or once weekly. It does show more sustainable weight loss benefits. A lot of people do the once weekly. The injectables, so the once weeklies are, we've talked about this before, are the Ozempic, Wegovy, Trulicity, Zepbound, Mounjaro, once daily, Saxenda, Victoza. There is the oral tablet, which is the Rybelsus, which is one tablet once per day. But of course, talk to your physician in regards to dosing. So Wegovy, Zepbound, Mounjaro seem to be the most effective from what we have seen. Wegovy is the GLP-1 agonist. It shows up to 15 to 20% of body weight reduction. Saxenda is effective for weight loss, but typically achieves less weight reduction. It does provide some benefits, but like I said, not as much as the other ones. Mounjaro, Zepbound, unlike standard GLP-1 receptors, this one actually has GLP-1 and GIP-1 receptors in it, resulting in greater weight loss and enhanced metabolic improvements. So all GLP-1 agonists effectively reduce HbA1c by 1 to 1.5% reduction on average. So that's pretty good to know. Side effects, we've talked about this previously. So short-term acting agents. They have fewer long-term GI side effects like nausea and vomiting, but the long-term acting agents may cause more pronounced nausea, especially during dose escalation. But they do subside over time. Okay, so once again, other side effects are pancreatitis and gallbladder issues. Significance differences between the GLP-1s for cardiovascular benefits. So as you look through here, there are different ones. So in the SUSTAIN trial, it was proven to reduce the cardiovascular events in people with type 2 diabetes. In the LEADER trial, it has been shown to lower cardiovascular risks in high-risk patients. In the REWIND trial, it demonstrates cardiovascular benefits, especially in reducing stroke risk. I was actually a clinical research coordinator in the REWIND trial. So it's pretty cool to see this on the screen now. So indications, all GLP-1 agonists are approved for managing type 2 diabetes. Okay, obesity is more Wegovy, Saxenda that have been FDA approved specifically for chronic weight management, as well as Mounjaro, okay, or also Zepbound. Cost and accessibility. So cost of these medications can be quite intense. Some insurance companies do cover it. Some insurance companies don't. Okay. You can also ask your physician's office if they have samples. Some physicians' offices do. If cost is a factor. Once again, this all needs to be done under a physician's care. Okay. Now, summary table of key differences. This is a great one to have. It kind of shows you what is the most effective medications, if it's been proven, what is the primary effect on it. Take a screenshot of this if you'd like, just so you have it for future reference. Conclusions. So, Monjaro, also Zepbound, is often preferred when the goal is maximum weight loss and significant HbA1c reduction, as it targets both the GIP-1 and GLP-1 receptors. Next in line is Ozempic, Wegovy, Rybelsus, also highly effective for weight loss and glucose lowering through GLP-1 receptor activation. Foods that support GLP-1 secretion and metabolic health. So foods high in protein. So you always want to make sure that your client or patient is eating foods high in protein. It will keep them fuller longer, and it also helps to regulate blood sugar. Next one is fiber-rich foods. So we want soluble fiber, which slows gastric emptying and increases GLP-1 secretion and improves blood sugar control. Okay, so here's a couple examples of that. So oats, barley, fruits, lentils, different vegetables. Really good for you. Number 3 is fermented foods. Okay, so you definitely want to add this in. So foods like yogurts, kefir, kamshi, sauerkraut, it enhances the gut microbiome health, indirectly promoting GLP-1 secretion. It also improves digestion and reduces inflammation. Foods that support GLP-1 secretion. Number 4 is healthy fats. So fats that stimulate the release of GLP-1 through the gut hormone response are avocado, nuts and seeds, olive oil, fatty fishes. You do want to pair healthy fats with protein and fiber-rich carbohydrates, which helps enhance the GLP-1 activity and supports stable blood sugar levels, reduces cravings, and promotes more appetite control. Number 5, bitter foods. Bitter compounds can enhance GLP-1 secretion and improve appetite regulation. So things like avocados, nuts, seeds, olive oils, fatty fishes. Number 6, resistant starches promotes the production of short-chain fatty acids in the gut, which may enhance GLP-1 secretion. Okay, improves insulin sensitivity and gut health. Foods that support GLP-1 secretion for number 7, which is spices and herbs. Certain spices that improve insulin sensitivity and indirectly support incretin hormone secretion, which is cinnamon, turmeric, and fenugreek. Foods rich in omega-3 fatty acids are salmon, sardines, walnuts, and flax seeds. These help reduce inflammation and may indirectly enhance the secretion of GLP-1s. Number 9, low glycemic index foods. So low GI foods promote steady blood sugar levels, reducing the need for high insulin responses. So whole grain sweet potatoes, non-starchy vegetables like broccoli and cauliflower. These prevent post-meal blood sugar spikes. Green tea, it boosts metabolism and supports weight loss. Okay, lifestyle factors to complement the dietary choice. So we want to do meal timing. Eat smaller, frequent meals, balanced with protein, fiber, healthy fats that can naturally stimulate GLP-1 secretion. We want to exercise. Okay. We want to do stress management. So chronic stress and poor sleep can suppress GLP-1 secretions. So practices like mindfulness and proper sleep hygiene are crucial. Limitations of food-based GLP-1 stimulations. So individuals with severe obesity or poor control for type 2 diabetes may not achieve the same benefits through diet alone. Conclusion, we need a diet rich in protein, fiber, healthy fats, fermented foods, and low GI options. Combined with healthy lifestyle can mimic some of the effects of GLP-1 receptor agonist by improving appetite control, blood sugar regulation, weight management. However, medications may provide stronger and faster benefits to individuals with more significant metabolic challenges. So I want to thank you for attending my Metabolic Reset webinar. I appreciate you guys all being here. I love this. As a special thank you, I am going to have a 30% off of my 6-month Metabolic Reset program. It is a global launch. Dates will be announced soon. Please send me an email at kayla@triplegoddessnutrition.com if you want to be on that list for when I do launch that. I look forward to helping you through your journey. Thank you and have a great night.